I had the fortune of speaking with Dr. Ann Childress, who was your principal investigator
Sure.
on the CTX 1301 trials. And she brought up something that I thought was quite interesting, because I asked her what was the population that was having the most new prescriptions. And she said it was young adult women. So I thought I'd ask you also, what segments are you targeting, and what might surprise us about some of these populations?
Yeah, I think, we never want to just chase one demographic because it is such a wide market, but you bring up a very important point that those young adult women play an important role in a number of ways. One, they have ADHD in some cases. They're being, as Dr. Childress pointed out, they're coming into the offices of physicians and having more discussions. So we want to make sure that we're speaking to them as patients, right? But that demographic is also the caregiver in the household most of the time. And women, whether we like to believe it or not, as men, like we're not as active in our own healthcare and the healthcare in our families as we should be, right? Speaking. And so that demographic actually provides a very important segment called the caregiver segment that we'll speak to. So what we're doing right now is we're really listening. We're doing a lot of listening. We're working with and listening to the advocacy organizations that are in the space, but we're also commissioning research around just listening from a digital and social perspective on what is that segment saying? What are all of the patient segments saying? What do they really need? What are their needs? What's unmet in the category? And so we're doing a lot of listening, but on day one of launch, we'll be where they are. We'll be providing information the way in which they want information. It'll be appropriate information around just the education of what's going on in the space, but also appropriate and clinically relevant information around our product.